My name is Donyale Strayhorn, and I will be presenting my persuasive speech on unveiling the challenges beyond the scripts. Nursing, where every heartbeat is a call to action, every breath a testament to resilience, and every decision a potential lifeline, the realm of nursing. Today, I will be discussing the debate behind why nursing stands as one of the most difficult degrees to earn and sustain. And my thesis statement, nursing stands as one of the most difficult and challenging degrees to obtain and sustain due to its rigorous academic demands, the intense hands-on commitment, and the emotionally taxing nature of the profession. So why is this important? Have you ever experienced a sick family member that required a hospital stay? Or have you ever been sick when you were little and your mom had to rush you to the doctor's office because you had a sore throat and a fever? More often than you may think, you were seen by the nurse practitioner and not by the physician. As stated by Mercer University, the time nurses spend with patients in hospitals is even greater, and a recent study of the time intensive care patients spent with at least one healthcare practitioner, around 86% of that time was with nurses compared to just 13% with physicians. So just imagine what the world would look like had these nurses not gone through the hardships and struggles that it took into earning their degree and helping your family member recover and helping you feel better. Nonetheless, with the difficulty of schooling, nothing is done to better the mental health of nurses or to make the process of earning their degree a more positive experience. And to top it all off, following the career, nurses aren't protected, they aren't respected, and their degree and journey are downplayed. So we as students, we as patients, and the higher-ups need to do better in improving this field. So what could we do about it? The nursing curriculum is only the beginning of the difficulty in earning the nursing degree. From physiology, pharmacology, patient assessment and care, nursing research, health ethics, and public health, the curriculum is very vigorous and very fast-paced, so the time for extracurriculars and alone time is very minimal. Nursing takes a great amount of dedication, and you will often be placed outside of your comfort zone, especially with clinicals, and then you will have to prepare for your NCLEX that gives you that big title, but it's very stressful and a lot. And you are not required to memorize your material, but to understand your material as you are dealing with someone's life. The school systems can better improve this by providing enhanced mental health support, streamlined curriculum, ensuring clinical experiences input into the curriculum, financial support, and hospital collaboration to ensure a smooth transition from schooling into the career field. We can also input some flexible scheduling options. So, a solution to improve the safety of nurses within the hospital. As stated by Dr. Dennis Taylor, Taylor said one of the issues for healthcare workers is that there's very little prosecution for these crimes, as there is no federal law that protects healthcare workers from workplace violence. So, they were installing more weapon detection systems at hospitals. And what you can do as a non-nursing student to better respect your fellow nurses and not downplaying their journey or giving into those stereotypes is to advocate, educate yourself, and to just be supportive. Have you ever experienced waiting in a waiting room for hours, or when you're finally taken back, you're waiting for hours again? This is why this must be handled, because these are due to nursing shortages. And as nursing shortages increase, it'll be more of an inconvenience for both parties, the nurse and the patient. And as stated by Bradley University, this is expected to rise close to 3.2 million in 2024 as compared to around 2.75 million registered nurses in the country in 2016. We need to handle this because this will have negative effects on patient mortality rates increasing, more increasing medication errors, and hospital overcrowding. So, what should we do? We need to advocate for more mental health care and safety for healthcare professionals, and not just how healthcare professionals can keep other people safe, but also focusing on keeping our professionals safe. Educate yourself, take the time to understand the curriculum and demands of nursing, learn about the diverse responsibilities and skill sets required by your nurses, and support the nursing majors. Publicly acknowledge and express your support for them and acknowledge the emotional and compassionate aspects of nursing, and just be there for them physically and emotionally. If you know someone, be there for them. They're going to need it. So advocate, educate, and support. In conclusion, to close out my speech, the arduous path of nursing education is not just a degree. It's resilience, compassion, and a solid commitment to humanity. So as you think about the challenges faced by those on this difficult journey, let's recognize that behind each nurse's degree is a story of great dedication and sacrifice. So, nursing is not just a degree, it's a calling by the bravest of hearts. So, next time you meet a nurse or a nursing major, understand what they've conquered and the challenges they've gone through and continue to go through and conquer each day. Nurses come out and prevail as the heroes of the world, and their health, mental health, patience, and respect are continuously tested, and they continue to leave a mark on the world. So, thank you for listening to my persuasive speech. Bye.